Welcome back to Conversations with Boston School Psychologists, building safe and supportive schools, one conversation at a time. This podcast is where we highlight the people, practices, and partnerships shaping behavioral health and school psychology across Boston Public Schools. Today, we're so excited to have Dr. Carolyn Hall. Thank you so much for joining us.
Thank you for having me.
Yeah, absolutely. And she is the program director for the Boston Public Schools Comprehensive Behavioral Health Model, or known across the country as CBHM. Carolyn leads district-wide initiatives and evaluation of multi-tiered systems of support for behavioral health, while also providing professional development, supervision, and technical assistance to school psychologists and school staff. She co-facilitates the BHS research team, working to close the research to practice gap and amplify the impact of school psychologists in Boston and beyond. Before stepping into her current role, she served as a school psychologist in both school-based and district-wide positions, supporting BPS students and privately enrolled Boston residents from preschool through young adulthood. She has long been an advocate for equity and systems change, serving as co-chair for the BHS Equity Committee, a union representative, and a mentor to colleagues entering the field. You also recently got your PhD. Congratulations on that. And you focused your research interests on literacy intervention. Is that correct?
That is exactly correct, yeah.
Wonderful. Okay, so I'm sure we're going to be talking a little bit about that, as well as just your overall journey as a school psychologist. And why don't we start with that? Why don't you tell us a little bit about your story? What led you to school psychology?
So, like many people in the field of school psychology, I wouldn't say that my path was necessarily a direct one. However, looking back, I'm able to see that every step I had along the way made total sense for where I am today. So I started my undergraduate studies at Keene State College in New Hampshire, where I got a bachelor's in health science. My major was community health education, and I had a minor in substance abuse prevention. So those two definitely laid the foundation for me in terms of my work in mental and behavioral health. So when I was young and eager and entered the workforce, I first worked at an inpatient adult psychiatric unit. And I was a counselor, and I was able to run groups, help with crisis intervention. And in that work, while I was really able to find and learn a lot about myself, I also realized that when you're working with people that have such significant needs, I became motivated to be a part of the solution and preventing things from getting to that point. So that's when I started, after a couple of years in that role, I started to think about maybe I could find something that aligns a little bit more with my background and interest in prevention and systems change. And that's when I started to explore grad programs, which ultimately led me to school psychology.
That is wonderful. And so you've had numerous roles in the Boston Public Schools in a relatively short amount of time. How did you begin stepping into leadership roles as a school psychologist, and what ultimately led to your current role at the district level?
Yeah, so my journey into Boston Public Schools tracks back to during my graduate studies at UMass Amherst. A lot of my experiences were in suburban as well as sort of rural areas. So when I was starting to look for internships, I wanted to have that urban school psychology experience. I was also in a place in my career where I wanted to find an internship that would allow me to get dual licensure as both a school psychologist and a health service psychologist. So Boston was one of the few schools in the nation that really allowed me to get that dual training that I was seeking at the time. So I came here in 2021 as a doctoral intern, and during that year, I spent half of my week at a K-8 placement doing the traditional role of the expanded role of school psychologist, as well as half of my time at central office, where I was able to help to coordinate and assist with professional development for other school psychologists, as well as sort of learn the ins and outs of what it's like to be an administrator. So I really started as an intern, and then when I entered the field, I was at a K-8 school as well in Boston, and I did that for a year, and one day a week I was at a high school. So in a typical school psychology week for me, I was one day I was with kindergartners, the next I could be with high schoolers. So I really just kind of honed in on my assessment and intervention skills that year. But at the same time, in the back of my head, I was like, I still really like this systems change and advocacy work. So when the opportunities presented itself to be a part of some of our department-wide committees, that was an opportunity to continue my gaining skills in that area as well. And then the following year, I wanted to continue to develop my assessment skills, but also see more schools across the city. So I took a role as what we now call the Equitable Share School Psychologist, formerly known as the Prop Share. So in a district as large as Boston, we're required to service students that are not only Boston Public School students, but students that are privately enrolled Boston residents. So if for example, a student that attends a private school, their family or their school thinks they require an evaluation, that gets sent to our team, the Equitable Services team. So I was a part of that. So when I think about my different roles that have led to this role, it was really just gaining a lot of experiences both as a school psychologist, but also as someone that was interested and involved with committees. So that my second year as a school psychologist in the district, I also was one of 5 union representatives, which really mobilized my advocacy skills and kind of challenged me to think outside the box to be able to support my colleagues as well in advocating for a new contract. That was also a contract year. So I feel like, to kind of wrap things up, when I think about if I felt like I was necessarily ready for a leadership role. I don't know that we're ever 100% ready, but I felt really grateful when the opportunity presented itself. And this particular position really aligned with sort of my interests in program evaluation, systems change, and also supporting colleagues. So I feel like it was sort of the right time and the right place to give it a try.
Yeah. That's wonderful. And now let's get into some practical tips for school psychologists. So you did your dissertation, your doctorate degree on literacy interventions. And what recommendations based off of this experience could you give to school psychologists in this area, as well as when it comes to consulting with teachers who are looking to help students who are struggling in reading? What would you recommend for school psychologists?
Yeah. So, what's awesome about a district like Boston is that our school psychs have all different roles across the district. So some have that sort of role where it's mostly testing and some counseling, but others are really leading school teams. So we have student support teams or student success teams, which we call SST here. And having a school psychologist in the room, I think that's a phenomenal opportunity for us to use our multi-tiered systems of support training that we receive in grad school to support schools in collecting data to make our decisions. So I think as school psychologists, we are uniquely positioned to help teachers, but also help create the systems that are required to be able to collect that information. So when I think about my experience, for example, my dissertation focused on during COVID, schools quickly shut down and we had to kind of pivot and think quickly of how to get supports to students in a way that was efficient, but also meaningful. So I trained a group of America Reads tutors in our college community to deliver a remote repeated reading intervention. So I think when I think of how that translates to my role now, it's how do we get school psychologists to push in evidence-based practices into schools and then to collect data as to whether that intervention is the correct match for what the students need. And if not, take some data, and if it doesn't work, do we need to change the dosage of that intervention? Do we need to try a different intervention? So I think that instructional to intervention match is also an area where we can support students and teams as well.
Absolutely. And you're also very passionate about equity. And so do you want to kind of give a similar type answer to how you would recommend to school psychologists to go about helping support equity in schools?
Sure. I feel like that is such a big question and an
Sorry, it's a
important
loaded
question.
question.
No, no, no. When I think about how can, as a leadership team and as, someone that is in a district leadership role, I think that first that starts with ourselves. So for me, my journey has been a lot of continued learning, but also pushing myself just a little bit beyond my comfort zone and being willing to have challenging conversations, both in my personal life and my professional life. So for me, that journey has been, attending lots of events, whether that be in the community or in educational spaces, reading books, having conversations with loved ones, and really just trying to stay informed on what's happening in the world, both locally and nationally, and beyond. And in terms of what that looks like for supporting our staff, I think that one thing that our department does a really good job of is embedding equity into our everyday conversation. So, for example, when I was an intern, I got to co-facilitate sort of and shadow the leaders of our equity committee. And what that did is it allowed me to step up into a position where I was facilitating for 100 school psychologists and 50 graduate students every month, activities on how they can reflect on their own cultural and linguistic awareness, as well as so part of it is thinking and reflecting, but also how do we make these small changes in our practice to be more culturally responsive and aware? So, in terms of our work as school psychologists, I do think it's important to kind of acknowledge the elephant in the room that our field is really grounded in some, historical practices that did have some significant implications for students and families. So I think that when we know about history, it's our job to kind of inform ourselves so that we can do better in the future. So some of those early conversations that we had were really looking at the history of the psychological tools that we use. Are we using tools that are appropriate and reflective of the student populations that we work with? For example, even like having conversations around mental health, are we doing that in a way that is welcoming to families?
Fantastic. And so we also want to shift gears to talk about the BHS research team. And so you talked about how we were trying to reduce that research gap between research and practice. And so, can you talk a little bit more about the BHS research team and what it has accomplished?
Yeah, so I'm super excited. So we just finished our sort of reboot of our behavioral health services research team. So I think it's important to kind of share a little bit about our team composition, and then I'll get into some of our goals and missions. And actually, that's kind of one way that we have had the opportunity to work together this past year. Is in that capacity. So, for those of you that don't know, our BHS research team is composed of representatives from local universities to the Boston area. So we have people that sit on that team from Northeastern, um, University of Massachusetts, Boston, as well as Boston University. So to just name a few, as well as our community partners. One of our longstanding partners, most notably, is Children's Hospital. They have been integral to the creating and expanding of the comprehensive behavioral health model here in Boston. And finally, that is really an opportunity for us to kind of come together also. So those are our research and community partners, but also with members of our team. So I think that it's really a bi-directional approach. So when we think about minimizing the research practice gap, which is well documented in our field, I've read somewhere that when we think about what research has shown to be true, it sometimes takes more than 20 years to really make changes into our practices. So here in the behavioral health department, what we try to do is think about what are some of the pieces of research that are kind of going to have the greatest impact on our work with students and families. So we think about are the practices that we're using evidence-based. So selecting interventions, selecting curriculum, selecting assessments that are well-researched and evidence-informed. And then over time, we have to collect data, ongoing practices that allow us to monitor our own practices, so that's part of that is collecting data on ourselves, but also the students we work with, and then using that data to lead long-term program evaluation efforts, as well as in specific areas, some research studies. So one of the other things that we're really proud that our research team has allowed us to do is to support the work of our doctoral students. So we have a lot of students that come here to do their graduate training, and part of that training requires a dissertation. And sometimes one of the barriers to completing those dissertations in districts is kind of navigating data sharing practices, and there can sometimes be some red tape. So we want to kind of make that as smooth of a process as possible to support our graduate students, but also to select projects that are aligned with our mission here in behavioral health.
So just to clarify, I want to make sure I heard that right. So you're saying that the research to practice gap is so big that there are research that comes out and it takes about 20 years for it to truly get put into practice oftentimes. Is that what you're saying?
Yeah. So that is in mental health as well as in education. So as school psychologists, that kind of affects all areas of our work.
Yeah.
So I think it's important to kind of knowing that what can we do to be a part of the solution to help minimize that gap.
And where does professional development play a role into this? So are you training staff on the best evidence-based practices, things like that, in order to have awareness of these new research that's coming out and the evolving best practices that we're doing as school psychologists?
Yeah. So just to think of a few, here in Boston Public Schools, we have a lot of um, different opportunities for supporting staff to implement these evidence-based practices. However, there's also so many things happening all at once. It's really important to kind of take a step back and be really thoughtful about how are we training our staff to implement these practices. So it's one thing to just put evidence-based curriculums into their hands, but are we implementing those curriculums with fidelity? Are we selecting the right intervention based on the needs at the moment? So I think that when I think of what types of professional development are we supporting our staff with, that comes within our district coaching model. So having central staff that are available to coach our school psychologists on the best practices. It also means investing in tools that are research-based. So one that comes to mind that's significant to my role is I support the implementation of the BIMAS 2, which stands for the Behavior Assessment, Intervention, and Monitoring System, which has been a part of our behavioral health model really since the start. We've really grown with that tool and developed a long-standing relationship with the developer. And I think that part of that has allowed us to both monitor student progress, but also these large-scale program efforts of how our model is affecting students district-wide for over a decade.
Right. And can you, for those who are not familiar, can you just briefly describe what the BIMAS 2 does, how it both progress monitors and helps identify students at risk when it comes to problematic behaviors, and how thorough is this screening process that the Boston Public School does using the BIMAS 2?
Yeah, I'd love to. So the BIMAS 2 is a social, emotional, and behavioral assessment. It has 5 scales. It looks at 3 areas of challenging behavior, as well as 2 adaptive scales. So it kind of talks about academic behaviors as well as social behaviors. And it also looks at things like your cognitive attention, which is things like executive functioning, planning, organizing, executing tasks. So it also has, most notably, it measures internalizing concerns, which is called the negative affect scale. And that kind of, when we think about students with challenging behavior, a lot of those are explicit or overt. You can see them. However, when we think about internalizing concerns like anxiety and depression, the best way to get a pulse on that is to ask students. So when we first started screening, we did significant work with teacher report. So we would have teachers report on all the students in their classes. And I would say in the last 5 years, we've really expanded our use of the self-report version where, especially on the high school levels, the students themselves are completing the self-report version of the BIMAS 2. And then based on their responses, they're kind of placed into risk categories. And based on the levels of risk, we're able to identify the students in greatest need so that they will have an adult that can, for the kids that are flagged as at risk, we have procedures and protocols for mental health staff to check in with them after screening, as well as follow up with families. For students that are at some risk, we can think about maybe they would be a good candidate for a tier 2 intervention. And then for kids that are in the green or not indicated at risk, it's still a good data point to see. And also, what are their strengths? So sometimes you'll see that, wasn't really thinking that this student was good in that area. Like, what a success.
That's fantastic. And it sounds like the vast majority of students in the Boston Public Schools are being screened on the BIMAS-2.
Yep. So on a district level, for a while, CBHM, and that can be, a whole story maybe for another day. But when we originally rolled out the model, it was using what we call a cohort model. So we sort of onboarded 10 schools about at a time every year. And that's sort of what worked for us for the first decade of implementation. Now we're in almost, year 15 of the model. We are sort of starting to pivot as our district has kind of changed some of their MTSS procedures. So we have to work with a lot more departments that are ever changing their goals and initiatives. So we want to work collaboratively with them. So what that means is that the BIMAS-2 is now available to all Boston Public Schools. When I think about completion rates this past year, I would say about 2/3 of our schools did some form of screening. And we continue to think about our goal would be for 100% of schools to engage in screening. So there is still some work to do. Our highest completion rates were just before COVID, and we're starting to get back there. But yeah, I'm really excited to see where it takes us.
But still, probably over 20,000 students per year, maybe even over 30,000 students per year, we're talking, being screened on the BIMAS-2. So that is an incredible feat. And I have one last question for you today, Carolyn, which is, what keeps you hopeful in a time when school mental health is so needed and often under-resourced? What motivates you to keep pushing forward?
Wow, I love this question. Thank you for ending with this one. For me, it really makes me think about my why, my purpose, and I'm really lucky that I am able to have a career that aligns with my purpose in life. I think that for me, my why is school wasn't always a place where I loved to be growing up. There were definitely pockets of times where I had, a teacher or a coach that I was able to have a connection with. And when I think about the school experience for students and thinking about one thing that we do know, we talked a little bit about research earlier today, is that having one supportive adult in your life is one of the most well-researched protective factors for students against mental and behavioral health challenges. So a lot of times that could be a mental health provider like a school psychologist. So when I think about what keeps me hopeful is that even though I don't have as much direct contact with students as I once had, I am still supporting the mission of supporting safe and supportive schools for students, and as well as the systems and policies that trickle down to families and communities. So yeah.
I think that's wonderful. I think we all have to have an important why as school psychologists. And it's so great that now you're able to be on the other side supporting students and making sure that they have strong connections with adult staff. Because sometimes that's all it takes to really bring a student, to turn it around for a student. And so that is wonderful. Thank you so much for sharing your story today. And thank you, the listener, for listening to Conversations with Boston School Psychologists, building safe and supportive schools, one conversation at a time. Please follow us on our socials, Boston School Psychs, and visit our website, bostonschoolpsychs.com, to learn more about our work. Join our next conversation to learn more about resources and tips for creating safe and supportive schools. Thank you so much.
Thanks, Tim.